Head injuries are a common problem, and in some cases they require little treatment. However, always be aware that problems can be difficult for a first aider to find. Your brain is a sensitive organ surrounded by solid bone, the skull, and fluid to further protect it. You should always suspect a spinal injury with head injury, as you need to assess the way that the injury happened and make your decision if a spinal injury could have happened. People can be at different levels of consciousness. They could be fully alert or dazed, appear unconscious but be able to hear fully, or even be unconscious. When dealing with a head injury, you need to find out what level of consciousness the patient has. You can use the AVPU scale to make your assessment. A. Are they alert? This means, are they alert enough but not necessarily orientated? Are the eyes open, and do they respond to questions? V. Voice. Do they respond to voice? Can they answer simple questions or commands? The P stands for pain. Do they respond to touch or pinching? This could be where you pinch them and their eyes are open. And finally, U stands for unresponsive. This is where the patient does not give any eye, voice or motor responses. Ideally, you should record your findings and repeat your assessment to report whether the condition is improving or deteriorating. If you have any concerns, activate the emergency services, as head injuries could be very serious. When dealing with patients, take care of them and monitor them carefully. Sometimes they can act out of character, maybe aggressively, and there's not always an obvious injury site, as it may be a result of shock through the spine from an impact on their feet, and the impact of those feet transmits up through the spine to the base of the skull. There are different types of head injury, and the first one we'll look at is concussion. The brain can move a little, and the shaking of the brain due to a blow to the head can be a cause of concussion. A concussion usually produces a temporary disturbance to the normal brain function. Symptoms of concussion can be from mild to severe, and in some cases emergency treatment may be needed. The most common symptoms of concussion are headaches and dizziness, nausea, loss of balance, confusion, difficulties with memory, and finally being dazed or stunned. Cerebral compression is where the pressure on the brain is caused by swelling or bleeding, and this is a serious condition. The swelling can be due to a buildup of blood within the skull or swelling of the injured brain tissues. Cerebral compression is usually caused by a head injury, but it can also be caused by stroke, brain tumor, or infection. Cerebral compression can also occur immediately after a head injury or after a few hours. Signs and symptoms include a personality change, deteriorating levels of consciousness, noisy breathing which becomes slow, an intense headache, vomiting, drowsiness. The pulse will be slow but strong, unequal pupils, weakness or paralysis down one side of the body, and finally, tiredness and evidence of injury. Cerebral contusion is where there's bruising on the brain, and this happens in around 20 to 30% of all head injuries. Brain blood vessels get damaged and leak, causing a pressure build-up. Signs and symptoms would depend on the location of the contusion in the brain, but they include motor coordination problems, numbness and memory problems. Skull fractures are where the skull is fractured due to direct or indirect forces. There's sometimes blood which is straw-coloured or clear fluid coming from the ears or the nose. Blood in the whites of the eyes and evidence of impact, depression or bruises. Treatment for head injuries are all the same. Be aware that there could be spinal injury. Treat for bleeding, activate the EMS, lie the patient down with the head and shoulders raised, monitor the patient's breathing, and do not give them any food or drink.